So I had a chance to review pictures, and in this case, I think a tummy tuck is your best option. Now, a tummy tuck puts a scar that usually goes from hip to hip. It could go a little bit farther back. I make that decision during surgery because I don't want to leave you with dog ears. Those are those excess skins that hang out on the side and don't look that attractive. But typically it's a hip to hip scar that we're going to do, and I usually put it in the bikini line as best as I can. I tend to combine my tummy tucks with liposuction of the waist, the back, and sometimes other areas where I can get fat if I can get to it, and then I transfer that fat to the buttock. That way it's more of a three-dimensional procedure where I'm not only working on your front, but I'm also working on your back. That way you look good walking into a room, but you look even better walking out of it. So for me, tummy tucks are three-dimensional. Some people won't do liposuction of the sides, and what you do then is, if you do a tummy tuck, you just create a flatter look and you're still a bit boxy. So I like to create curves and contour with my tummy tucks. Now, the biggest fear that people have with these tummy tucks is the scarring, and frankly, that can be a problem. Some people heal very, very nicely, hard to tell. Others don't heal so good. That's why we're trying to hide it in the bikini line to give you the best hidden scar that I can give you. Now, how do you deal with the scar? Well, there's different things we can do. Number one is that you could tattoo it the color of the skin. That's a new art form that's out now where people tattoo these scars the color of the skin. So go on YouTube and look it up, skin color tattoos after surgery. The other thing is you could tattoo it, with little roses or whatever those tattoos are. I mean, I welcome you to put my name and address and phone number on there. That'd be terrific. But if you don't, then you can do those other kind of tattoos. Next, we would do probably silicone patches or tape that you could put on there for about 3 to 6 months. You could consider laser. If the scar is thick, you can go ahead and inject Kenalog into it, which is a little bit of a steroid. So there's a few things that you can try doing with scars. But frankly, given all the skin that you've got right now, the appearance that's there right now, the tummy tuck is probably the best option to get you a tighter look to that skin, to rejuvenate the torso, to give you better waist, to give you a prettier buttock. I do make a new belly button, but it tends to be a cute one. It's more of an innie than it is really an outie. There's some belly buttons that don't look that great. It just looks flat, and people are always complaining and say, please don't do that for me. So that's why I take it and I anchor it down to the muscle so it has a little bit of a curve to it, and there's a hill and a valley to the belly button. So we do make a new belly button. I am gonna tighten your stomach muscle. So it's like lifting the hood of the car. I'm taking a look what's under there, and then I'm working on everything underneath, and that tends to be the muscle. So I'm gonna tighten you as much as I can to give you a flatter stomach and to give you a better waistline. There is a limit as to how much I can tighten you. Remember, you've gotta breathe. So I use these special devices in surgery that help monitor how much I can tighten you so that we do it safely. But that sometimes means that I can't get you the flattest stomach that you wanted because your body wouldn't allow it. And I never know how tight I can get you until I'm in surgery. So some people wish that I could have tightened them more, but believe me, I did the best that I could in that one surgery. Very rarely does that stomach become loose again. There are certain people that have a particular anatomy that no matter how tight you get them, that just comes back. And unfortunately, that's your anatomy. We can give it a whirl one more time, but sometimes I just can't get it perfectly flat. Bottom line is that I'm going to go ahead and I'm going to make the incision in your bikini line. How long it'll go, I just don't know. I'll combine it with liposuction. I'll transfer that fat to the buttock. You might ask me, well, how do I protect this? Because you got fat in the butt, you got the tummy tuck. Well, you sleep on your side. So what you're going to do is sleep on your side so you don't squish the butt and you don't squish the tummy. You're really more leaning in, so you're sleeping on your bony part. The other trick is to go to Home Depot and buy those big egg crate mattresses and cut a hole in the center and then plop the butt right in the center of that thing, and now you got no pressure on the booty and you're looking straight up. So there's a lot of different options that you've got, but bottom line, protect the butt like gold. When you're sitting, that's not a problem. Just put a pillow underneath your legs and you're good to go. If you're coming from out of town for a tummy tuck, lipo, and fat grafting, you need to stay in Miami for at least 10 days. Getting back to work is 10 to 14 days. Getting back to the gym is 2 months. Remember, I've tightened your stomach muscles up, so I don't want you to kind of break that apart. So just give me 2 months before I get you back into the gym. I'm going to put you in a garment, but not that day. The garment goes on about 3 days later. I just want to make sure that circulation's okay. And finally, I'm going to leave a drain in because the body produces fluid. Those drains stay in for 5 to 7 days, sometimes a little bit longer. There's a new medicine called Exparel. It's amazing. It's revolutionizing the way people heal. That medicine I inject into the muscle during surgery, and you can only do it during surgery, and it goes right in the muscle, and afterwards you hardly get any pain, probably no pain from the tummy tuck. You'll get discomfort from the lipo, but you won't get any pain from the tummy tuck, typically. It's amazing stuff. I definitely suggest it. So, surgery will take me 3 hours. I'm going to pull the skin down. I'm going to lift the hoochie wanuchi up because that sometimes is droopy. We'll work on your belly button. I'm going to tighten those muscles up. I'd love to inject that Exparel medicine so you have no pain after. I do leave drains in. I do the lipo and the fat grafting. You getting back to work is 10 to 14 days. 1 month of protecting the booty like gold if you do get the fat grafting by laying on your side, no big deal. Put a pillow underneath your legs, no big deal. Or you just lean forward. So the fat grafting really won't add any time to your recovery time. It's just taking a little precautions here and there. The garment you're gonna wear for about a month, no working out for 2 months, and final results, 6 months. You always gotta give me about 6 months for everything to tighten up and to give you my final results. In the beginning, after this procedure, you may weigh more because you're swollen. Don't freak out. Clothes may not fit you. Don't freak out. You're swollen. I mean, people can gain as much as 10, 15, 20 pounds right after surgery because of the fluid. All that goes away and it comes down pretty quickly within 2 weeks. But don't freak out. Your body will look tremendously different for sure, but you just got to be patient with me in terms of the final results. All right, so a great question that people have is, if I do the tummy tuck and the BBL, should I really do the liposuction first in the BBL, or should I do the tummy tuck with lipo and BBL? Because if I do the tummy tuck, I'm limited to 1 liter of fat extraction. If I do lipo, I can get 4 liters. So many people are in that debate. Do I do one or do I do the other? Here's what I say to you. If I do the tummy tuck, because you need it, and I do the liposuction of the waist, the back, I transfer that fat to the buttock, I'm really taking care of a serious problem in the stomach because I'm making the stomach flatter, I'm getting rid of the flabby skin, I'm lifting the hoochie wanuchi, I'm pulling down the upper skin, I'm creating curves, so I'm getting way more for your money by doing the tummy tuck, lipo, and fat grafting. Now you're right, it does limit me to 1 liter. But that usually allows me to reshape, and I gotta tell you, about 85% of the time, people are really happy and don't have to come back. However, if you need the tummy tuck, and you say to me, I prefer to do the liposuction because I can get 4 liters and I can make my butt big, then I would say for sure we can do that. But you are for sure coming back for a second procedure to get the tummy tuck done. It's up to you. Do you wanna do the liposuction first and almost have 100% chance of needing to come back and get a tummy tuck done? Or do you want to do the tummy tuck, lipo, and fat grafting, give it some time, and then if you want, do more lipo and fat grafting, and there's only about a 15% chance of you needing to come back for that second surgery. However, if you do, it's even better because I can contour that stomach awesome. Okay, great. So let's have you talk to the coordinator and she'll tell you about pricing, scheduling, when it can be done, what do I need to do, what labs do I need. She'll fill you in on everything. They're extraordinarily helpful and they're here to make your process informative and easy. They'll even talk about financing if that's something that you want. I look forward to seeing you, and bye-bye. Stay safe.